In this section, I want to introduce some of the fungi. Some people pronounce it fungi, some people pronounce it fungi, and so of course if you pronounce it fungi, that gives you a lot of puns and jokes, so you can take a look at these whenever you want. So when we say fungus, what do I mean? So fungus is a eukaryotic organism, so that means fungi or fungi have a nucleus. So this makes them different from bacteria. They're more similar to us in that way. They can be unicellular, so they can be a single-celled organism. And when they have only a single cell, we call them yeasts. They can also be multicellular in a lot of different forms, but the common form that a lot of you are probably familiar with is a mushroom. So a mushroom is a type of multicellular fungus. They do have a cell wall, much like bacteria and plants. However, the cell wall is just made of different stuff. It's made of a compound called chitin. It's a type of carbohydrate, but it's different from the cell wall of bacteria or the cell wall of plants. And fungi have evolved and really taken over some critical roles in the ecosystem. Of course, this is Revenge of the Killer Microbes, so we're going to talk about how fungi can interact with people in a harmful way. But there are fungi that we eat, fungi that decompose, fungi that contaminate food, produce medicine, tons and tons of different things. So what are some fungal functions? Again, these are just different types of fungi that we can look at. We've talked about fungi in terms of like food spoilage. Fungi can cause plant disease. Fungi can produce antibiotics. Those are all functions of fungi that we've talked about. So now we'll talk a little bit more about how they can cause infection and how interesting they are in that way. So I thought this was really interesting, and I'll tell you why in just a minute. I know this headline is pretty old. It's from 2014 about a zombie fungus that enslaves ant brains. And basically what it does is when the ant is infected by the fungus, and this right here is the species name, eventually the ant is compelled to climb up on a plant or a stalk and kind of bite. You see it's like biting here, and then the fungus emerges out of the back of the plant brain, and that's where it can, out of the back of the ant brain, not plant brain, ant brain. And that's where it can release its spores. And the reason that I thought this was so cool is at the time that I very, very first taught this class, it's been a few years since the first time I taught this class, there was a really popular video game that has now been turned into a television show called The Last of Us. And the premise of the video game, and these are some stills from the video game, is that the fungus takes over the brain. Well, it takes over the whole body. I've never watched the television show. Weirdly enough, I can handle kind of gory video games, but I don't do well with gory television. My brother said it wasn't too bad, so that I could probably watch it, but I just haven't yet. But that's the idea. And so the fungus in The Last of Us is called the cordyceps fungus, and the real life fungus is called Ophiocordyceps. So I thought that was really cool. And so if you've seen the television show or played the video game, that's what it is. And so we don't know of any fungi that are capable of doing that to people, of taking them over and turning them into mindless, killing machines. But we do know fungi that take over animals like ants and prevent their normal function. So in terms of real life human fungal infections, some of the most common and most mild fungal infections are what we call ringworm. Ringworm can manifest itself in different ways depending on where you find it on the body. Even though it's called ringworm, it is a fungus. And some manifestations of that would include jock itch if we find it in the groin, athlete's foot if it's between the toes, and of course on other areas of the body as well. And these are usually pretty easy to get rid of. You can often go to the pharmacy and get this stuff over the counter, some sort of antifungal, tinactin. There's lots of them that you can buy over the counter fungal treatments. You can avoid these types of infections by avoiding public showers whenever possible. This is one of the reasons they tell you if you do need to use a public shower, like at the gym, you should wear like sandals or something. Or I guess if you live in the dorms and have to share a shower with many people. I was very lucky. My dorm room was like an apartment style, so I only had to share with one other person. If you keep your body clean and dry, the fungi prefer moist environments. So if you keep your body dry, it's a little bit easier. And so that's why you often see like the jock itch in the groin area where you might get sweaty, or between your toes, which might get sweaty as well. Now, this is an interesting type of infection because it can also be acquired from pets. So this is more common when people find stray animals that have, been feral. A stray animal is more likely to have ringworm, and you can get it from petting your animal. Usually a house pet is not going to have this. So here's some common manifestations. This is jock itch. This is ringworm on different parts of the body, and then here's athlete's foot. And this is a pretty severe case of athlete's foot. In general, though, these aren't really painful. They might be kind of itchy or a little bit irritating, but it's not a deep pain. And they don't spread throughout the body in terms of like they don't get into your bloodstream. They might spread over your skin like this, but they don't cause a systemic deep infection. Another very common type of human fungal infection is called candidiasis. It's caused by a fungus called Candida albicans. This is a yeast. It's a unicellular fungus. It can cause infections in different parts of the body. In the oral and esophageal areas, it's really only common in babies, the elderly, and the immune compromised. And we call it thrush. And I'll show you a picture of that in just a second. When a patient has thrush, usually you don't do an over-the-counter. It's usually a prescription treatment, but it most often works to clear the infection. However, what we are starting to see is just like with bacteria, we're starting to see resistance to some of these antifungals occurring. And so it can be very dangerous when we start to have these infections that no longer are being able to be treated. So in general, if a patient has thrush, it's really not that big of a deal because we can treat it. But remember, babies, elderly, and immune compromised people are always at risk for infection. And if the drug no longer works to treat the infection, this fungus is capable of getting deeper into the body, and it has been known to cause fatal infections. So it's really important that we follow the same antibiotic resistance guidelines. Only take it when you have the infection, take the full course when we're taking antifungals as well. And so this is what thrush looks like. You'll see these pockets of white fungal infection. This is on a baby over the surface of the tongue. We also see candidiasis as a genital infection. Symptoms would include itching, burning, and discharge. More commonly, you've probably heard of this called a yeast infection. It is more common in women, mostly because the genital tract is internal, it's warm, it's moist, and it's a little bit acidic, which these fungi actually like the acidity. Normally, the bacteria that live in the vagina can keep this fungus from overgrowing, but sometimes what can happen, like if you've taken antibiotics or perhaps you've changed your hygiene routine and you're using new soaps, or people who use the douching, you're not supposed to do that, like just don't. But usually you should just be using water. You don't really need to use soap. But anyway, any change in hygiene, antibiotics can affect the bacteria and allow the fungus to overgrow. And it's estimated that about 3/4 of women will have a yeast infection in their lifetime. And for this one, usually over-the-counter treatments are very effective. Usually it's I believe it's like a suppository that you would put in the vagina, or maybe a cream that you could insert. I think the trade name is Monistat, is the real common over the counter for a yeast infection. If you find that you have persistent yeast infections, that you're constantly getting them, that could indicate maybe a different kind of problem. So you might want to, seek more, thorough medical intervention. But if it's like a one-off, like, oh, I just took antibiotics, oh, now I have a yeast infection, it's really easy to treat, and I wouldn't worry too much about it. But again, if it's one of those recurrent, multiple times a year, I would definitely seek medical treatment. And so again, what happens is, this is showing the female anatomy. You can have the yeast inside the vaginal walls. More rare, but for people who are immune compromised, it's a possibility, is what we call pneumocystis pneumonia. This was actually one of the first infections that people were getting that was indicating that there was this new thing called HIV or AIDS. So patients, this is such a super rare infection that most physicians hadn't ever seen it before, but clusters of people were turning up at hospitals and medical clinics in major cities that had this really weird type of fungal pneumonia. And so it's one of the hallmarks of a patient who has progressed to AIDS, where their immune system is completely shut down. It leads to fever, non-productive cough, and a pneumothorax. So non-productive cough, if you cough but nothing comes out, like no mucus, no phlegm, that's non-productive. If you cough up stuff like mucus, that's productive cough. And pneumothorax means like your lung collapsed. Treatments can include antifungals, to, of course, get rid of the fungus, and steroids to prevent inflammation in the lungs, but there are lots of side effects from that. And so what you can see is a normal lung on an x-ray looks just clear, and then infected with the fungus, you can see all the little dots. And this is what it looks like under a microscope. Another common human fungal infection is aspergillosis. Aspergillus is a really, really common environmental fungus. It's found in the dirt, it's found in dust. When I teach microbiology, like for science majors, we try to sometimes culture fungi, and this is the easiest one. It comes like from the environment. If they swab anything in the environment, this fungus is going to grow. Now, it can be inhaled. It's often inhaled. Most people inhale hundreds of spores of this per day, but if you're generally healthy, it doesn't cause a problem. It can also infect wounds, and it's thought that a lot of people who have like mold allergies, this might be one of those that people are allergic to. It can also cause infections in the ear and eye and in the nail bed. Now, treatment would include antifungals. If it's gotten in a wound, you do what's called wound debridement. You remove all of the infection and you get down to the healthy tissue. And what can be challenging, though, is that if this fungal infection really takes hold in a patient, as it produces spores, those spores can travel throughout the body and cause more significant infection. And so what you're seeing here are like pockets of aspergillus infection in the brain and in some kind of muscular type tissue. So you're seeing these pockets of infection. This is one of the reasons that you shouldn't bring potted plants to people in a hospital, because the fungus is so common in the soil that if you bring a potted plant into the hospital setting, the fungus can get out and cause problems for patients. A more dangerous type of fungal infection is called histoplasmosis. We don't have histoplasmosis in California. It's more common on the East Coast and other parts of the world. It generally will infect the lungs, so it's inhaled, but it can spread in immune-compromised people throughout the rest of the body. And this is why there's often this I don't want to say taboo, but like, ooh, it's contaminated with pigeon poop, or, bird poop. It grows really well in soil that's been contaminated with both bird and bat guano. So especially, in the eastern part of the US, people who are exploring caves where bats live are more likely to get this type of infection. Or if you're working in a condemned building where birds and bats might have taken roost, that can be a challenge as well. It can evade the immune system by getting into cells of the immune system. And what the body does is it doesn't really know how to fight the infection, so it kind of just walls it off, and you'll have these pockets of infection in the lungs. And so here you can see in the lungs the spread of the fungus, and it can even cause like skin ulceration as well. So this is histoplasmosis on this person's lip. Some other fungal species that can be inhaled and cause disease include members of the genus Cryptococcus. So Cryptococcus neoformans is a fungus that is most common as causing disease in HIV patients. It's a yeast. It's inhaled as a single-celled form. There's also Cryptococcus gaudii, which can infect cats. And I have a cat that actually has this infection, and he's had it for, 3 years. And every so often he'll get a flare-up, and he's having a flare-up right now. I feel really bad for him. His nose swells up so big with the fungal infection, and I give him antifungals. And he hates it, and he hates me, so it's a whole challenge. But it can disseminate in cats, in people, etc. And so especially this Cryptococcus gaudii tends to be a little bit more dangerous, and it's really interesting because we didn't usually see it in the US. It was more of a tropical type of infection, and now it's made its way all the way up the West Coast into Canada. So antifungal drugs can help show at the door, but antifungals alone are often insufficient to cure infections, and surgery to resect or remove the infected lung or part of the brain is often required. And so this is the strange fungi that now stalks healthy people. And so here's kind of that life cycle of it. And again, it did not used to be in the West, and it used to be only like kind of tropical and subtropical, and now it's moved all the way up into Canada. And it can get into the skin as well, and you see it can cause these really terrible ulcerations, and it causes a really significant pneumonia. You may have also heard of this black mold that can grow in your home if your home is too moist and you don't have proper ventilation. So this is why you always should turn on your shower fan, right? This can be fatal when it's inhaled, so it's very dangerous, and remediation or removal is very expensive. The last fungal infection I want to talk about is one that is unique to the San Joaquin Valley and other parts of the country and parts of Mexico that have similar ecosystems. So Coccidioides is the name of the genus, Coccidioides or San Joaquin Valley fever. It's found in the soil in California, Arizona, western Mexico. This is one that they've done studies where, like, field workers in places like Bakersfield, something like 70% of field workers have been exposed to this infection and have had this infection. The majority of infections are asymptomatic, but symptoms can include lesions, fever, pneumonia, and it can be fatal. And anywhere from 3 to 5% of individuals will develop a chronic infection that's really difficult to treat. So here you can see a neck wound, facial swelling and wounding, and then this is even a dog that has started to waste away because it's infected. So again, really relatively common, thousands of cases per year. California is in blue. So the most recent data is from 2019. There's less data for a lot of these infectious diseases. It's harder to find data for the COVID years. I'm hoping within the next year or two, we'll start to see more updated numbers, maybe skipping the COVID years, but at least like for 2022, 2023. Outbreaks of valley fever have occurred among archaeologists. There was an outbreak after the earthquake in Northridge, which was in 1994. And in some of the prisons that are in some of these more desert kind of dry areas. And you can see that, the trend is increasing. So every year, more and more people are getting this type of infection. And what we also really see is that we see big spikes of infection if we've had a rainy winter and then a really dry summer, because in the rainy winter, the fungus grows really well in the soil, and during the really dry summer, it dries out, and then you inhale what's dried out. So to treat and prevent fungal infections, most people are at very low risk of a fungal infection. As long as you have a healthy immune system, very, very low risk. And again, treatment with over-the-counter or prescription antifungals works pretty well. There is antifungal resistance on the rise, but we have to be responsible users of prescription medication. And of course, if you can try to avoid areas where fungal spores are common, that would be very, very helpful.